Time to pucker up. It's time for Ask the Derm. Dr. Richard Chaffoo from La Jolla Plastic Surgery and Dermatology. Come down. Raul is here. Today it's all about those kissable New Year's lips. Good morning. Thank you for being here. All right, let's get to our first, the first thing we need to know when we're preparing for New Year's Eve and we want to have those kissable lips. Well, how do we prep our lips?
Right. Well, the big thing that we notice this time of the year is the lips are very dried out.
Yes.
So we want to use a lip balm, which is a great product to use. I tell patients a lip balm with an SPF at least of a 30 because it really will reduce all the harmful ultraviolet rays, and that's a great product just to use daily. I tell patients to put that on before they put on any makeup.
Very good. And we want to moisturize in addition to that?
Exactly, because the lips don't have any sweat glands or moisturizing glands, so they tend to dry out, and especially in this time of the year.
Okay, so you want to make sure, is there any type of particular moisturizer that you want to keep in mind?
Well, any kind of a lip balm, as long as it's got an SPF of 30, so you don't really want to shop price, you just want to look for a product that's got a good moisturizer and a high sunscreen.
Very good. Let's go next to lip plumpers.
So there is a great product I like patients to use. It's made by Skin Medica.
Okay.
And it's called a lip plumper. And it has a number of different products in it, but the best thing is it's a two-stage process. So the first thing is you actually use an applicator and will apply the product on, which actually has some human growth factors on it.
This is it right here?
This is it right there. And then in addition to that, it's got hyaluronic acid, it's got some antioxidants, so it's very powerful. After that's gone on for about a minute or so, you let it absorb in. And the second product that you put on is actually has a gloss, but also has niacin. And niacin is actually a vasodilator. We know the blood vessels, there are hundreds of blood vessels in the lips, and so this will actually dilate the blood vessels. That's a combination of those two.
And we have some pictures to show of what we're talking about right here. So this is the before, this plumper. And then we have an after picture to show you as well. Same person, same lips. You really notice it on the bottom right there on the bottom lip.
And you can apply the Erica daily to your lips to kind of keep them nice and plump.
Okay, interesting. Let's talk about lip fillers. This is more dramatic.
More dramatic, obviously. So if you've got some signs of aging, you've lost volume to the lip, as many of us do, get lines in the upper or the lower lip or around the corners of the mouth, you can actually use a filler. One of the things that we like is Juvederm, which is the same company that makes Botox. It's a wonderful filler that I use in the office a lot for patients. It has what's called HAs or hyaluronic acids, which are naturally occurring substances in the body, so there's no allergic reaction. Actually, you use it with a little bit of lidocaine or local anesthetic when it's put in. So we'll put a topical on the upper and the lower lip area and then wait a few minutes and go ahead and put the filler in. And you can actually titrate it. So you'll put a small amount in maybe initially, because the last thing patients want is to look like some of our Hollywood famous people with the duck lips. They're always worried about that.
Price-wise for something
so it's about $600 to $700 for a syringe.
Okay.
But oftentimes if we're just enhancing the lip, we may not even use a whole syringe. I'll put some in, I'll show it to a patient in the mirror, they'll say, perfect, and we can put their name on it and store it for later on, a week or two.
Interesting, very good. Well, thank you as always. We really appreciate your insight. To contact Dr. Chaffoo, you can do so by going to our website, Fox5SanDiego.com. Click that Scene On tab. The information is also on your screen. All right, Mr. Brad Wills, let's toss it on over to you.
All right, thank you. Good stuff, guys. Coming up in just a couple minutes.